Frailty is a clinical state marked by reduced physiological reserves and increased vulnerability to stressors. In the context of oncology, frailty is especially common, particularly among older adults with cancer. These patients often have multiple health conditions, take several medications, and may have compromised functional status. Frailty isn't just about age, it's about how well the body can cope with illness, injury, or treatment. When frailty is present, cancer patients face higher risks of complications, side effects from treatments like chemotherapy, and even increased mortality. Recognizing frailty early is crucial as it can influence which treatments are safe and effective. By understanding the interplay between frailty and cancer, healthcare providers can make more informed, patient-centered decisions, aiming to improve both survival and quality of life. This sets the stage for a more personalized approach to cancer care, focusing on the whole patient, not just the disease. Provide the best care for cancer patients. It's essential to accurately assess frailty. There are several validated tools and models designed for this purpose. A comprehensive geriatric assessment (CGA) is considered the gold standard, evaluating a patient's medical conditions, functional abilities, cognition, nutrition, and emotional health. For quicker screening, tools like the G8 and VES13 surveys help identify patients who may need a more in-depth assessment. Other scales such as the Clinical Frailty Scale (CFS) and Modified Frailty Indices (MFI5, MFI6) are practical for predicting surgical risks and treatment tolerance. For cancer-specific risks, the Cancer and Aging Research Group Score (CARG) and the Chemotherapy Risk Assessment Scale for high-age patients (CRASH) help predict chemotherapy toxicity. These assessments guide clinicians in tailoring treatments, balancing risks and benefits, and involving patients in shared decision-making. By integrating frailty screening into routine oncology practice, care teams can better anticipate complications and optimize outcomes. Frailty significantly influences how cancer treatments are chosen and tolerated. Frail patients are more likely to experience complications after surgery, increased side effects from chemotherapy, and longer hospital stays. This can lead to both undertreatment, where patients receive less aggressive therapy than needed, and overtreatment, which can cause unnecessary harm. For example, frail older women with breast cancer may be less likely to receive standard therapies, impacting survival. On the other hand, some treatments like hormone therapy or palliative care may be better suited for frail individuals. The key is to individualize care, considering not just age but the patient's overall health preferences and goals. Early integration of palliative care, less invasive surgical techniques, and careful monitoring can improve outcomes and quality of life. Ultimately, recognizing frailty as a critical factor ensures that cancer care is both humane and effective. Managing frailty in cancer patients requires a comprehensive multidisciplinary approach. Interventions such as tailored exercise programs, early nutritional support, medication reviews, and psychosocial care have proven effective in improving patient outcomes. Exercise, especially when customized to the patient's abilities, can boost physical function and resilience. Nutritional interventions help address malnutrition and support recovery. Regular medication reviews reduce the risk of harmful drug interactions, especially in older adults taking multiple prescriptions. Emotional and cognitive support, including counseling and rehabilitation, helps patients cope with the psychological impact of cancer and frailty. Oncogeriatric units, which bring together specialists from different fields, are increasingly recognized as essential for coordinating these interventions. By focusing on the whole patient and not just the disease, these strategies help maintain independence, improve quality of life, and reduce complications and hospital readmissions. Frailty should not be seen as a barrier to cancer treatment, but as a vital clinical parameter that guides personalized care. By systematically assessing frailty and integrating multidisciplinary interventions, healthcare teams can anticipate complications, prevent unnecessary suffering, and improve both clinical and functional outcomes. This patient-centered approach shifts the focus from treating just the tumor to treating the whole person, respecting their values and preferences. Implementing structured frailty evaluations, professional training, and institutional protocols is essential for equitable and effective cancer care. As the population ages, addressing frailty in oncology will become even more important, ensuring that every patient receives the most appropriate, compassionate, and effective treatment possible.